Greetings. Let us talk about tips on successful submucosal injection and how you could avoid or deal with either extramural or intramucosal injection. Extramural injection. How does this happen? So here is a polyp, a flat lesion. You decide to remove it with endoscopic mucosal resection, and then you get your needle catheter out, but your needle is still inside the catheter. When you ask your assistant to push the needle out and start injecting, this is what happens. The needle will go through and through, and as the assistant injects, he may push 5 to 10 cc's without your knowledge. This is one thing you should avoid. If in case you do the correct technique of having the needle out and then puncturing the wall, and if you end up with an extramural injection, you could easily find out by listening to what your assistant says as he injects the fluid. If he counts 1 cc, 2 cc, 3 cc, and you don't see a good submucosal bulge, that means your injection is through and through and you're depositing your fluid outside the wall. Once you recognize that, you will ask your assistant to stop injecting and gently pull your needle back into the submucosa and let him tap so that you could see the submucosal bulge, and then continue with the injection. It's not a good idea to pull the needle completely out and try to find another site. Instead, gently withdraw the needle, and as you withdraw, ask your assistant to tap small aliquots of fluid so that as the needle comes into the submucosa, it finds itself a nice place to create a submucosal bulge. Let's talk about how to do successful submucosal injection. When you see a lesion, you get your catheter out and then ask your assistant to push the needle out as you give yourself space to have the needle come out in the lumen without penetrating the wall, and with a gentle push of just a couple of millimeters, you enter the submucosa. Once you're underneath the mucosa, ask your assistant to tap, and when you see a nice submucosal bulge, you do a couple of things. Continue to ask your assistant to tap small aliquots till you're sure that it is only in the submucosa, and as this happens, you gently pull the needle back and scope tip up, and as this happens, you can ask your assistant to inject more to create a nice dynamic submucosal injection. This is how one does a submucosal injection. On the other hand, if you create a mucosal injection like this with a mucosal bleb, don't pull the needle out. Instead, push the needle further in to find the submucosal space And once you find the submucosal space, inject more fluid to create a nice submucosal bulge. If instead of pushing the needle, you pull it out, it becomes very hard to find the submucosal space with lots of holes allowing the fluid to escape out. Thank you.